So my passion as a vet is, there's two things really. One of them is making life nicer for horses that are in our equine hospital. No one likes going to the hospital or doctors, and of course horses are just the same. So how can we create a more positive experience for the horse? And secondly, keeping people safe. And this is something that I'm really passionate about. For those of you that saw my talk a few days ago, you'll have been astonished at the injury rates which the veterinary profession undergoes. It's the most dangerous civilian profession, so more dangerous than being a prison officer, a firefighter, working in the construction industry. And of course the other thing is time. So vets get really frustrated when they have horses that they can't deal with and treat properly. And there are different things that happen with that. First of all, the horse might not get the correct treatment because they might say, well, if we can't inject it, we'll just put some medication in the food instead. We might go away and do something else. We can't do a lameness workup on your horse because it's trying to kick us. Vets get frustrated quite easily because they're very, very busy people. So they then find themselves in this situation of having very little training and wanting to use a lot of force and a lot of constraint and control of the horse. So I do quite a lot of teaching, trying to get people to understand how we can actually do this much more quickly and easily. And certainly when I first started working at the University of Edinburgh, I was seen as the crazy lady, and everyone said, well, you know, we haven't got time for all this behavioural stuff, we are very busy vets. And it's interesting, over the space of a couple of years, they now go, we haven't got time for all these crazy horses. Gemma, can you please come and give us a hand with them? And that's one of the biggest things about when you understand learning theory, you can actually apply it really, really quickly for certain scenarios. And I'd say that's true of about 95% of horses that I deal with. The other 5% tend to be horses that have been referred to us from usually quite a distance away, anywhere from Scotland or the north of England. And those horses are the ones that the responses are so ingrained, they maybe take more like 15, 20 minutes to get over these problems. But again, a lot of vets have previously spent hours and often had to give up. So there are a couple of things that I want to get across. Obviously, as soon as anyone approaches with something like this, a lot of the horses show aversive responses. And of course, this is classical conditioning, whereby the horses see the stethoscope, see the vet, the way the vet acts and talks, and they find that quite aversive. So how can we start off on the right foot? Emily worked with me as a tech for a year, and I've noticed already she's been just scratching the horse. Emily actually did some research in this area. So one of the first things I teach the students is when you go into the stable with the horse, and obviously they're in a rush, and just as the vets are, you know, just go in and just give the horse a nice scratch. And straight away, we all know that it lowers the horse's heart rate. Straight away, you're starting off on the right foot with the horse. And for a lot of horses that are difficult to catch, just going in and scratching the horse makes all the difference to them. So there's three things that I want people to try and get across today, and I'm going to try and teach it as I teach it to students and as I teach it to the other vets. The first one is understanding how important negative reinforcement is, and I'll refer to it today as removal reinforcement for the most part, because I find that vets and students understand that a little bit easier, and then once they've got that, then I try and get them onto the correct terminology, and how that actually influences the horse's unwanted behaviours as well as the behaviours that we want to train them. The second thing is to understand the concept of shaping a behaviour, because we all know what we want to end up with, but you can't start there. If you imagine going to somewhere like Sea Life Centre, they may have trained a dolphin to jump out of the water, jump through a hoop, do a treble somersault before landing. They don't wait for the dolphin to offer that behaviour and then reward it. They have to start with something really easy. And you've got to think of the same with horses. You know, I could say, well, I'll do some positive reinforcement. I'll inject the horse and then I'll give it a treat. Well, that's fine, but what if you can't get near the horse to inject it? You need to find something easier, something that you can achieve. And then the key to good shaping is being able to break it down into lots of little easy steps. The more you can do that, the faster you'll accelerate. And then the last thing is I'm trying to get vets to be more aware of arousal levels in horses, because when horses are particularly aroused, particularly fearful, particularly painful if they've got a horrendous wound or something, then they're a lot harder to work with. They can't learn as effectively. And along with arousal, thinking about a positive emotive state. So we've already, we've said we can go into this horse, and if every time we go in, we just give the horse a nice little scratch, the horse has a nice experience. What are the next things that the students might have to do with a horse? And many horse owners will have to do this, particularly people that take heart rates for endurance or eventing. Well, obviously, and I'll just put this around my neck so that I can still talk to people and hear them, you're going to want to put the stethoscope on. And it's really common for students to go up and do that with the stethoscope because they're just so focused on the anatomy and where the heart is and hearing that, and they're not thinking about the horse. So something we could do a bit nicer is just give the horse a quick scratch, and then when you put the stethoscope on, you can even scratch here and just slide your hand down and rub, and then put it into the tickly area. And I should say, by the way, sorry, this horse doesn't really have any behavioural problems. It doesn't have any veterinary aversions. We kind of asked around, but I don't think there was too much. But that's great because it means I can show you lots of things. So just thinking about, rather than just slapping it on the horse, just going down. The same for horses which don't like us listening to their gut sounds, their abdominal sounds. So a lot of students will come up and go. Fantastic example of negative reinforcement. The horse moved, I stopped tapping. Now you can imagine with our students that are having to do this every 4 hours, day and night, after a couple of days, as soon as you walk to the horse like that, we've even got the head up, the horse starts to go, whoa, I'm not liking this. So there's two things that I get the students to do. The first one is whoever's holding the horse can give them a scratch here. And the second thing is I say to the student, be nice about it. Horses like being stroked. So why not stroke the horse? Notice where I'm standing. This is obviously about safety as well. I apologise for my back, but you don't want to stand here and do this because a lot of horses will kick out when you go near the flank region. So by standing here, making contact with the horse, rubbing, I can then listen there. I can then stroke, listen there, stroke, listen there. And for the horse, it's a much, much nicer experience. And we'll actually get a lot of horses which perhaps were becoming difficult to catch in the stable because of all these things that have been done to them. And then they get to the stage where they really, really start to enjoy being caught. Could you just face that way? Yeah, so they've got his bum. So something else that we have to be able to do with horses is to be able to set the horse's temperature. And this is something that we have a lot of students from across the world. We have a lot of North American, Canadian students, but we also have quite a lot of Asian students. And students that have come from places like Hong Kong have often never seen a horse before. So you can imagine they're taught that horses kick, and we're then asking them to come up and stand behind the horse and take the horse's temperature. So they get really tight and really tense about this. And what they want to do, and I won't do it, is grab hold of the tail and lift it up and get it in as quickly as possible. And again, from the horse's point of view, they then duck under, step away. Maybe the horse will lift a leg. If the student backs off, next time the horse is going to lift the leg higher and lift the leg faster. Negative, removal, reinforcement. That's how you end up training horses to kick you. So again, why not start at the wither, stroke the horse, and you'll find if you stroke horses just on that little area of hairless skin, they actually just start to lift the tail very slightly. And I can feel now this tail is nice and loose and relaxed. And come away again and stroke again. And then again, you can just stroke in here. And some horses offer more of a response than others, but I can feel that tail moving away from my fingers each time I do that. And then you can just start to get closer in and closer in. Notice where I'm stood still. It's absolutely impossible to be nowhere near the hind legs if you're going to take the horse's temperature. But just by doing this, I can then feel, and I can actually just feel with my finger. There you go. So you get that little response. And I can feel that. And then I can just very slowly and gently put the thermometer in. And again, the horse have a good experience. We had one horse in the hospital, and the students said at the morning rounds that you couldn't take the horse's temperature. So I showed them this technique. We worked on that. And I said, look, if you guys want to practice it, that's fine. But this horse had been kicking out quite violently. So I said, look, if you find the horse is getting too aroused, if you find the horse is quite worried about it, then stop. Just leave it at that, and I'll come in and do it this afternoon. So I came in that afternoon, and they said, Gemma, we want to show you what we've done with this horse. And they went into the horse's stable, and the horse went, because they were scratching the horse's bum. So from a horse which was in a veterinary hospital whereby every 4 hours, 8 hours, it was having a fight with people and was terrified. It now loved it when people came and it's stable. I did say to students that's maybe not the best thing in the world to train a horse to swing its bum round to people when we're sending them home to the owner. But you know, it's just nicer for the horses. So you've always got to think about not just when you're putting pressure on, taking it off, but how you put the pressure on, how you can make it nice for the horse. So let's have a think about some of the other things that horses are aversive to. So do you want to come over just onto the centre line? So again, a really common one is giving horses oral medication. And the things that people will say to me is often, horse owners will say, my horse doesn't like being wormed because he doesn't like the taste of the wormer. My horse doesn't like this, because of that, because he's dominant, because he's naughty. But let's think about what actually happens. And I've been told this horse is very good for worming, so it probably won't demonstrate it quite as well as we would like. But what often happens is people will go, they'll take out of the head collar, they'll shove the wormer in, and the horse will lift its head up. And then that's a really good example of negative reinforcement, removal reinforcement. So as soon as we go like that, like I said, this horse is good with him, but as soon as we do that and the horse lifts its head up, the distance between the syringe and the horse's mouth has been increased. What's even worse is if you put the syringe on the horse's mouth and the horse just jerks back slightly and that syringe comes away. And every time you get that release of pressure, you are training the horse that throwing its head up is the correct response. The way I describe this to horse owners is the horse will think, oh, that's fine. I can make the syringe go away. All I do is I just throw my head up each time. So I'll then turn around to the students and say, well, how are we going to work with this? So we know that we've got removal reinforcement, negative reinforcement working against us. How can we use this? And the most common answer that the students will come up with is, okay, well, you just need to put the syringe in the horse's mouth and hold it there until the horse stands still and relaxes and then take it away. Well, that's a lovely concept, but when you've got a horse, particularly a big horse like this, that's throwing their head around, it is impossible to keep it in contact. So you're always going to get that release, release, release. And then you find each time the horse's head goes higher and the speed with which it jerks back gets faster. Eventually you may train horses to rear doing this. So this brings me on to the second thing that I said was really important, and that is shaping. And that is creating a situation in which you are going to succeed, making the right answer easy for the horse. So for most horses, I will often put a hand on the head collar because I think touch and contact is quite important to them. And I may put my syringe there. And the horse will often lift its head up. And as soon as the horse stands still and relaxes a bit, I remove the syringe. And then I'll do that again. Ideally, even wait for the horse to drop the head very slightly, remove the syringe. After a couple of repetitions, you start moving further and further down the horse's face. And again, the way I describe this to owners is the horse thinks, gosh, that stupid blonde vet, with all the other people, when they went to put the syringe up to my head, to make the syringe go away, I had to throw my head up. That's a fear response. With this stupid blonde vet, all I do is lower my head and start to relax, and the syringe goes away. So the horse thinks that they've trained you to remove the syringe. But of course, through doing that, each time you get closer and closer, and the horse is then not scared of having the syringe there anymore. Because they're not scared, they actually don't mind quite so much that you're not removing it. So thinking about the shaping principle, you've got to always monitor what you're doing and how effective it's been. So if I put the syringe here and the horse throws its head up high enough that I'm not tall enough to keep it in contact, then I'm failing. And to be honest, even if I can keep it in contact, if the horse is really doing this, it's becoming really aroused. Whenever the horses are too highly aroused, as we saw in an excellent talk yesterday, they're unable to learn effectively. So I need to stop and say, well, maybe that is too much. Maybe I'll come back here and work on it there. Once you get there, then you may go down a little bit further and a little bit further. And you've just got to keep finding that threshold where the horse can cope with it. You want to find that threshold where the horse starts to kind of lift the head up very slightly, or at least they become aware of what you're doing. And then just wait until you see them start to relax slightly. and release again. And then, of course, at some stage, you actually do want to be able to put this syringe in the horse's mouth and dispense the medication. And what you don't want to do is do this, and then go, right, now I'm going to get it in, and change the way you're doing things. So again, I think touch is really, really important to horses. So I'll teach the students that they put their hand there and slide down, remove for the correct response, put the hand up here, slide down to here, remove for the correct response. The next thing we might think about is just touching the syringe, keeping the length of the syringe like that, and just touching the corner of the mouth. If you try and do this, it's really easy, as we saw a little bit then, for the horse to move their head slightly and lose that contact. So the first time you start touching the lips, I would actually just keep the syringe in contact at that sort of angle. Then, and each time I come back and I slide down, I think it's more of a visual stimulus. And don't forget, a lot of these horses, we are having to do things quite quickly. You know, maybe if this was my own horse, I would want to teach them that this visual stimulus doesn't mean anything aversive. But these horses, they've already got that habit that this visual stimulus creates a fear response. So I'm trying to change it. So each time the students start here, slide down, put it on the mouth and wait, and then step back. Then when you are ready to put it in, the next thing I do is I slide it there and slide it down so that I just keep the corner of the syringe in contact and come back. And then I'll keep the corner of the syringe in contact. Again, if the horse brings the head down, release. And then just slowly rotate it. Notice that my fingers are still in contact with the horse's muzzle at all times. And that just means as you keep your contact, if, as a lot of horses do, when you actually put it on their tongue, they move their head slightly, it means that your hand and the syringe moves with it, and you don't end up getting that jerking response. The worst thing you can do is actually tap the horse on the hard palate with the syringe, because that's something they find really aversive. To be honest, for most horses, that works really, really well. And it's amazing how many horses that we're giving oral medications such as metronidazole, which are really aversive to it. And the students say, oh, they don't like the taste of it and all this and all that. For me, it's actually the fear response that's been associated with having the oral medication that they don't like. And once you get away from that fear response and get horses standing calm and relaxed, they're actually pretty chilled out about it. And again, I can't think of a horse off the top of my head that I've not then been able to insert the syringe, give the medication, and then come back and do it calmly next time. It doesn't seem to set anything off. On the other hand, why not make it as positive as possible for horses? Just because we can do it that way, it doesn't mean we can't do it better. So something else that we'll often do is just dip the end of the syringe in some molasses. And if we do have medications such as metronidazole that we know, doesn't have the nicest taste in the world, they certainly won't eat it in feed, you can make a molasses sandwich. So you drop a little bit of molasses in your syringe, you drop the metronidazole, and then you drop a tiny bit more molasses. So the first thing and the last thing that the horse tastes in their mouth is molasses. You're a good gal. So let's move on to the needle-shy horse. Now, apparently the only thing this horse was very slightly nervous with was injections, but whether or not she'll show a response, I'm not sure. So again, how do we end up training horses to be needle shy? Well, most vets come up and they do this, and if the horse moves their head backwards, they lose contact. Negative reinforcement. Then they do this again, and they lose contact again. Then they do this again, the horse steps back, they lose contact again. And what you'll observe with these horses is that each time that happens, it'll start off with a small response, and you're actually shaping the wrong response. So each time, the horse's head goes up higher and faster, then they take a step back, then they do a kind of sit back on the haunches, then they'll do a tiny kind of jump back and a little rear, and then they start doing bigger rears. And I've been out to lots of horses which have been trained by vets to really stand up on their back legs and wave their front legs at you. And people say, oh, the horse is dominant, the horse is naughty. It's not. The vets have trained that response. I know they haven't meant to do, but the vets have trained that response. So how can we turn that scenario around? Well, first of all, just as we did with the oral medication, we can just use the negative reinforcement. But this is something where overshadowing can come in quite nicely. And I think this does help. You need a competent handler. which is why I'm really pleased that I've got Emily with me today. Poor Emily, I should say, didn't find out she was doing this until about 10:30 last night. So for overshadowing, it really helps to have a competent handler. So do you just want to do a few steps forward and back? So Emily's going to put pressure on and then release the pressure as soon as the horse takes a step backwards. Release the pressure as soon as the horse takes a step forward. Now you'll notice, I'm glad you repeated that one. Could you notice the first forward response, the horse lifted the head up slightly? So that tells me that the horse doesn't understand the step forwards response 100%. It's not bad, it's better than most horses. So this is nice and light, and this is something that Andrew talked about earlier on. So this is super. So then the next thing is to come in there, and again, this is where you really have to think about shaping. You really have to think about how can I make it easy for the horse to succeed. So for some horses, even standing here is too much. And for some horses, even just trying to approach them, they can't cope with. So that's where you'll maybe get the handler to do some things with them. For most horses, you can't go near the injection site, so either down the jugular vein or here for intramuscular injections. So again, we know that horses like being scratched here, so why not start here? Just diverting slightly, I get a lot of owners that I will go out to inject the horse and they'll say, oh, you've just got to be really quick. You've only got one chance. And they're holding on to the horse like this. And you've just got to get in there. You've just got to do it because you've only got one chance. And then and I say, oh God, oh, that's awful. Oh, poor horse. What happened to you? And they say, just do it, just do it. And I'm, oh, I've not drawn it up yet. It's all right, I'll go draw it up in a minute. And I'll just stand and give the horse a nice scratch. And I'll say, so your daughter was at Pony Club last weekend, was she? How did that go? And, start these sorts of conversations. And then you find that when you can scratch horses really nicely, the horse then starts to relax. And then the owner goes, oh my God, my horse doesn't normally like vets. I don't know why he likes you. And then the owner relaxes. Again, we've seen lots of studies which have shown that when the heart rate of the person increases or when fear is induced in the person, the horses get the same response. The gracious animals, the herd animals. So being able to calm the owner down is really, really effective. And that's why we're really lucky in the hospital that we have technicians such as Emily who can help us, who are calm and relaxed regardless of what the horse is doing. So going back to what I was saying, I will often come in and just try and put my hand there. And then I'll get Emily to step the horse backwards. I always start off with a backwards response, as Andrew said, because we don't want the horse to try and run over the top of us. And what you'll find is that response is often quite heavy. This horse isn't too bad, so it's not. So when the horse steps backwards nice and lightly, as this horse has done, I'll just step away for a second. And then I'll come in again, and I'll put my hand a bit closer. And again, Emily will step the horse back. And that was fine. So I come away again. You've got to think about shaping. So what if I come in next time and do that, and the horse reacts badly to it? Well, first of all, you can do the stepping forward and back, but perhaps another thing to do next time is then to try and find an intermediate step. So previously my hand was here, it then went to here. So what are the variables that have changed? One is the positioning. The hand was there, then it's gone there, but also my hand's turned round. Also, I've gone from having a flat palm to just my thumb putting pressure on the jugular. So that was 3 variables that I changed in one response. So you really have to think to yourself, how can I make it easier? So first of all, I might even just bring my hand here. Then I might put the back of my hand, put the whole of my hand on. Then I might slide it round to raising the jugular. And each time I do this, I want the horse to become more desensitized to the skin in that area. Horses that are needle shy become really hyper aware to any touch in that area. So even normal touch induces a fear stimulus in them. We know horses like being scratched. So each time I approach, again, I don't just approach the jugular because that's too hard for them. So I'll approach the neck and scratch down here, and then I'll scratch along here and stop. And then I'll do the same again and scratch down here. Now 1, the horse is really enjoying that. 2, the fact that I'm scratching, and each time I scratch harder and harder with my fingernails, means that I'm actually desensitizing the skin. It's a bit like, if you kind of tap yourself or rub yourself or something, you actually desensitize that skin a little bit. What's the next variable we need to bring in? Well, it's okay being able to do this, but you're always going to have the syringe in your other hand. And horses, again, this is a visual stimulus, so I will often come in, scratch, and I often get to the stage whereby at this point I can just come here and then scratch, and then I'll bring this hand across. Again, I want to keep contact with the horse, so I'll often lean on there. See that we've just got a small response, so just step back there, Emily, for me. And a forward. And stop. And then remove the hands. So this horse isn't that bad. We probably don't need to overshadow this very much, but I want to show you the techniques. So again, I'm come in, scratch, bring the other hand up. That's it, step back. Step back again. So I don't want to release when we've got that response. Back again. And release. And notice that the horse's head is slightly lower when I took my hands away. That's something else that we want to be looking for with these horses. So again, scratch, put that on, step back, and release. Scratch, and release. Good. And release. So that's another variable. I'll give her a 2-minute break there because we did a few repetitions. And don't forget, when horses are learning new things, there's new pathways being fired in the brain. You can see there's a little bit of licking and chewing going on. So there was some sympathetic stimulation there. She did find that a little bit aversive. And hopefully now she's coming back down into a parasympathetic state.
Gemma, I'm going to give you still another 5 or 6 minutes. But I'm going to interrupt for just a second. For those of you that want to go over and hear Jan Ludwig's talk on the next 23 hours, you can follow me. He's going to start at 2:15. So if you're okay for just a couple minutes for people that want to leave their seats, but you can carry on. And for those of you that are staying, you can hear the rest of Gemma's demonstration. And then at 2:15, Jody Hartstone and Emily Corey are going to demonstrate applying learning theory to foundation training right here. So if you prefer to stay for that one, you can. But those of you that want to hear Jan's, you can follow me at this time. Thanks very much.
So when we're doing this, it's quite important that you give horses little breaks. And it doesn't have to be long. It can just be 20 seconds, 30 seconds. But when horses are learning new responses, there's new pathways being fired within the brain. And whenever that's happening, that's using glucose and oxygen. It's using energy. So these pathways become depleted quite quickly. And even though the horse, you know this horse is a fit, athletic horse, she's doing nothing physically, but mentally she will be doing things. So this is where just giving them a little break, just stepping away for a second, allows those pathways to be replenished with the nutrients they need, and then you can come back and do some more work. If I've just got another couple of minutes, I'm actually going to throw another thing into the pot. So one of the reasons that I want to talk about overshadowing was because I would say that for the less aversive horses, I can just use negative reinforcement or removal reinforcement alone and get really good results with that. And that's what I tend to use when I'm out on a yard somewhere and I've got an owner who's not as competent as Emily holding the horse, and she may be holding the leader up at the end here because, you know, they're scared themselves, or sometimes the owners will be looking the other way. I was once digging out a foot abscess in a horse, in a hind foot, and I'm crouched over here digging it out, and I saw there's some pus coming out here, and then the owner appeared at the side, and they just completely let go of the horse and come round. So that's the thing that I would tend to use now. So for most horses, I can use that quickly enough that it's effective. But for the horses that find it more aversive, the overshadowing is more powerful. You do have to have someone that understands about releasing the pressure when the horse steps back or forwards, and someone that if the horse does try and run forwards over the top of you or becomes fearful, is able to put that little bit more pressure on and work with you. And one of the things that I will do with that, so I'll just demonstrate this, is sometimes we have horses in that come in and they are really needle shy. Vets have really struggled to get an injection into them before, but they have got a massive cut on their back leg. And you don't even want to wait 15, 20 minutes to work with this horse because maybe you think it's in a joint, maybe the bone's exposed. So what's the quickest thing you can do? Well, this is when what I'll do is scratch the horse and get Emily to step it back and keep stepping it back. And as she steps it back, I actually give the injection as the horse is moving. So Andrew explained how overshadowing works really nicely earlier on. I have another explanation, and that's that horses, like men, they can't multitask. So they can't think about two things at once. So if we can get the horse concentrating on stepping back, then we can actually inject them without them feeling anything, or less likely to feel something. And the great thing about this as well is once you've got that horse under stimulus control to be able to step it forwards and back, even if you put the needle in and the horse kind of does this, they then go, oh yeah, okay, yep, that means backwards. So you don't continue getting that fear response when you're attaching things and actually injecting them, which you do normally. So I wanted to show you removal reinforcement. I also want to show you a little bit of positive reinforcement. And again, this is something that I'll use with some needle-shy horses. And this is something I tend to use if I don't have a competent handler with me, with horses that are more food motivated than pressure motivated. I don't want to be stereotypical, but if you've got a young racehorse off the track, they're not often that motivated by food, but they are really motivated by pressure. And just by removing your hands each time, they think, God, that stupid blonde vet. All the other vets, when they go to inject me, I have to rear up to make them let go of my vein. This stupid blonde vet, all I do is stand still and relax or step back and she lets go. That's really easy. Some of the more cobby types, some of the more ponies, are less motivated by pressure, and are more motivated by food. So they're some of the ones that will actually, I don't want to say they've got less of a fear response than the thoroughbreds. I'm not sure that they have. They still find it really aversive, but they will work harder for food and they will try and cross the boundaries of their fear a bit more for food. So what else can we do with these horses? I'll put it the other way around. Don't get tangled up. To make it easier for them. Well, one thing we do is positive reinforcement. And don't forget, we've been talking about this a lot. Every time we talk about scratching the horse here, we're talking about positive reinforcement. So we use positive reinforcement for taking the horse's heart rate, the gut sounds, the temperature. A scratch alone is brilliant. When you've got horses that are really needle shy, that's probably not going to be big enough for them to really want to go with that. So this is where I tend to use food instead. And I tend to use a clicker because it's a really distinct sound. So horses seem to pick up on it, that it's new. I will sometimes use my voice. My voice does work, but horses, as you'll notice, I talk quite a lot. Horses easily drone out to us. So in this situation, what I might do is scratch the horse. And I'm waiting for the horse to stop shaking its head. You must have had apple before. I had to buy these apples. No. I'll let you try. Maybe try a couple. See if any are any nicer. So, see, it's vets. Told you horses don't like vets. So the click signifies the timing, and the timing is really, really important with these techniques. So we've got your attention now, haven't we? So again, we can come in. Oh, I'm going to ignore that one because that wasn't what I wanted. Wait for the stop shaking, and then click. You're going to have one this time? Yes. And the reward. Horses learn chains of events really easily as well. So it would be very easy for me to end up training this horse to shake and then stand still. To be honest, if I've got a horse with a massive wound that I need to get sedated really quickly, that's not the end of the world. But generally you can try and do something to break that chain. So you could even, that's better. So we've got less that time. Now look at that. This horse has obviously not heard clickers before. I'll let you keep trying with a bit of apple. But the third time, after the click, it immediately turned around to see what we had. And that is my experience. A lot of people talk about having to train the click first of all, but I find a lot of horses learn it really quickly. Again, and go. As soon as we relax, stop. And the other thing that they learn in terms of chain of events is the click is always followed by me reaching for the bum bag. So that's another stimulus for them. And I think the other thing, whilst the food is important to horses, I think, again, it's all about the operant conditioning, the controllability. So the horses feel that they can get someone to let go of their neck and to get the click. The click just helps signify that timing for them. So I tried to get it before we got the neck shake. The other thing I do with regard to shaping, so we've got to the stage whereby you can put the syringe against the horse's vein while the vein's been raised. The other thing is a lot of horses at that point would still react to the actual injection. So one thing we can do is actually then start to press it on. And I would normally have a needle attached to this, but I'd normally have the cap on the needle. Can leave that one. So each time I start off pressing lightly, each time I press harder and harder and harder. And what I tend to find is when you get to the stage whereby you can really press hard, so you have to pretend that there's a needle, but when you can really press in like that, without the horse giving you any reaction, 99 horses out of 100 will not react to the syringe, to the needle being inserted into the vein. So that's a really quick way of working with horses. And people often say, but how long does it actually take in real time? Well, I would say for most needle-shy horses, it takes between 30 seconds and a minute. Some of them maybe up to 2 minutes. The horses that I get referred in from far and wide, which have got lots and lots of problems, sometimes 15 or 20 minutes. But they're often horses which either it's not been achieved in the past or it's taken a team of vets up to a couple of hours. So they really are the extremes. So once you start trying this, the things that start off with an easy horse, because you're going to learn a lot faster that way. And then the things to think about is 1, your timing, and 2, the shaping. So you've got to remove or click at the right time because that's going to reward that behaviour. And you've also got to think about starting with an easy response and then making it progressively more difficult. And if you find 2 or 3 repetitions whereby you're not getting the response that you wanted from the horse, then that's just feedback for you that you were maybe asking a little bit too much too soon, and come back a level to something that you can achieve, and then go to the level that's in between them two. And you've got to use your imagination a little bit there. Sometimes people say, well, I can do this, but I can't do this. Well, there is no in between, but there always is. You've just got to try and think of it. So I think in the interest of time, I'll probably stop there and see if we have any questions.
What recommendations do you have for hand-walking horses being rehabilitated in the beginning of rehabilitation when they're pretty high?
Obviously, we know that you get this response once horses have been confined for a long period of time, that they've got all this excess energy that they need to be able to do something with it. It really helps if your in-hand responses are really good before your horse gets injured. That's not always possible, but even in a stable, you can teach horses to step backwards, to step forwards. And this is where you can actually use bits of kind of negative punishment, but only if you're really, really skillful at this. So you could take the horse out for some grass in hand and lead the horse, halt it and allow it to have grass. And if the horse is getting to the stage where they're trying to pull away from you or doing this, you just walk it back to the stable and then you can bring it out again. And when the horse is calm and relaxed and walking with you, you get to continue walking and grazing. But when its arousal levels are getting too high, you just go back to the stable. In those situations, I do actually advise that people start off with a little bit of ACP, which is a very mild tranquilizer. So it reduces anxiety in horses. It doesn't sedate the horse can still eat, they can still walk, but that can be really useful because it just takes that edge off of them. The other thing that I try and get people to do with horse on box rest is keep the mind active. So you may not be able to take the horse out of the box, out of the stall, the stable, but what you can do is do some training within there. So as well as teaching the horse to step forwards and back, why not do some clicker training to a target? Why not teach the horse something else so that the horse's mind is being active? And then at least, when you do take them out and start doing some in-hand walking, you can then use that. So if you have done some clicker training with a target, you can walk them out and get them to walk to a target, then get them to walk to another target. And they become focused on doing that and not just wanting to go and launch and buck and things. But ultimately, it's such a strong response in horses to want to be able to express their natural desires after they've been confined. From a safety point of view, for the horse as well as for the person handling it, I think a little bit of ACP doesn't do anyone any harm.
So that was excellent, really, really helpful, Gemma. Thank you. I'm interested in when you then do a procedure that ultimately is pretty aversive, right?
Yeah.
I mean, so it's something that the horse really nobody would find pleasant, and you've done all this work to kind of assure them that you're not going to do anything horrible, and then you have to do something horrible. How do you deal with that?
So I think our perception of horrible and the horse's perception of horrible are sometimes two different things. As we're going back to the last question, I think box rest for horses is one of the most horrible things we can do for them. Whereas me, I quite like being snuggled up in my bed. So one thing you could do for anyone that's on Facebook, if you go onto the In Practice veterinary record, if you search for veterinary record, that's the British Veterinary Association publications, and there is video footage on there of me dealing with a needle-shy horse and using overshadowing. Now, the history behind that horse was she was an Arabian horse that was used for FEI level endurance. She'd always been very needle shy, and people had tended to deal with that by getting her to put her head over the stable door while they offered her some feed, and then darting her with the plastic line as she shot back in, because they said she was too dangerous to go in the stable with when they were trying to inject her. As these things happened, she was very successful at an FEI endurance event, and they said, well, you're due to be dope sampled, to have a random blood sample. And the owner said, look, I don't think you'll get a needle into this horse. And the vet said, well, I'm a big, strong man, and I've been working with horses for 20 years. I'll get it off of her. So she started to rear, and each time she reared higher and faster, she struck out and struck him on the shoulder and injured his shoulder, not too badly, but, you know, it could have been his head, which, again, is why I'm wearing a hat. It's always good to wear these things when you're dealing with horses that you know, from a safety point of view. And anyway, he actually persisted at that point, and she actually reared up and flipped herself over backwards and went through the temporary stabling. And at that stage, the owner just said, forget it. You know, I know I'm eliminated, and not just eliminated, but I think under FEI rules, if you failure to produce a sample, you actually can't compete again for a long period of time. She said, that's fair enough, I'll just have to do this. Well, then she managed to injure herself, and she came into our equine hospital about when I was starting. And she had to have a general anaesthetic, she had to have surgery. So I think there was something like 6 of our vets ended up, somehow they got some injection into her. One of them had a bone broken in his foot through this procedure. She had the surgery, they couldn't get near her in the stable, they couldn't do anything with her. She went home, and a few weeks later she was due her annual vaccinations. So this is when I was telling everyone about how much I love needle shy horses, so I was sent out to do it. So look for that video. And one thing that's really interesting is, first of all, she never got aroused, because the first thing I did was do the stepping forwards and back. So you're breaking that chain. Remember, classical conditioning, predictability. Most vets are coming in and going straight to the neck. I did something else with her, first of all, so I broke that cycle. And then I think the video's like 2 minutes long or something, and we give her annual injection just into the muscle. And her owner was thrilled, because she says normally she can't sleep before the vet's due, because she's so worried that someone's going to get injured or the horse. Now, finally getting onto your question, I'm sorry, I'm blathering a little bit, but the next year I went out to inject that horse, and as I say, the first year I was there for 2 minutes, 2.5 minutes in total. The next year I think I spent less than a minute doing it. The third year I went there, I just injected her as a normal horse. I just went up, scratched her, injected her. Since then, some of our other vets have been out and injected her without problems, and even the vet whose foot she broke, actually she came into the hospital for x-rays, and he was able to have her stand quietly and calm and do that. So I actually think the needle, I'm sure it's not a nice stimulus, but I don't think it's as aversive as we sometimes think. I think the problem is the fear response that's generated through vets trying to get the needle in, the horse showing this fear response and the pressure of the needle going away, and you train a fear response in horses, and that is far more aversive than the actual needle. So my experience is, and it's the same with the oral medication, these horses just become more and more calm and relaxed each time you do it. So if you do things well, it's not a problem.
My question is about the timing of your handler, about implementing the backing up, or do you have her start the horse to back up before you put the needle up there, or?
That's a really good question. So I think a lot depends on the individual horse and where you're up to with it. So what I like to be able to do, what I don't want them to do is for them to step them back as I'm approaching the horse, because that's going to be removal reinforcement. So what I tend to do is put the hand on. And with a horse like this, it's fine because she's not worried. But horses that are really worried, as I go to put the hand on, the horse will actually often try to step forward. They're trying to escape. It's a flight response. Notice someone's found the apples in my bag now. So it's as I put my hand on and there's that forwards pressure on the halter, the pressure of the nose and the halter should always be associated with a backward step. So my handlers are generally good enough that as soon as they feel that, they'll step the horse backwards. And I would say as soon as I kind of go up, they'll do the backwards and then maybe a forwards a step. Okay, thank you.
Thanks, Gemma.
Thank you very much.